is lameness, what to look for, and then also that's tricky subject of like, when is it actually lameness or when is it a behavior causing the issue that you're experiencing as the rider, as the trainer? And then again, once you know that you need a lameness exam, what is the lameness exam? What are we doing when we do all of those things? And I'll have you keep in mind, I'm just going to throw out there that some of this also applies to pre-purchase exams and things that you guys can look at when you're going to meet the horses and ride the horses, and what you can kind of expect too as you're actually in the process of vetting the horse, which I know is a big deal, and nobody gets to the vetting process without a lot of thought and emotional investment. But just, it breaks my heart when I have to be like, no, really, this horse is not suited for you. And here are all of these like very obvious problems. Cause I know, like, I never ever say that lightly because I know it's a big deal. So the more you guys can kind of look for these things and then decide like, I'm okay, you know, I've noticed these problems and I want to figure out what they are. Like, I've noticed these problems and I'm going to keep looking for a while. So again, the whole point of this talk is to give you guys the power. So lameness, when your horse just isn't quite right. Lame does not have to be a 4-letter word, even though we think of it that way. Sometimes it's just the changes aren't as clean as they used to be, or, you know, your horse's stride length isn't as adjustable, and it might be a lameness issue, which we're coming to the definition of that in a minute. It might be something else, but if you notice changes like that, where your horse is not performing the way they used to perform, or where they know you're capable, what they are capable of, it might be time to just pay a little bit more attention. So the definition of lameness is officially an abnormal stance or gait, essentially caused by a problem with the locomotor system, or you'll hear me call it the musculoskeletal system, which is exactly what it sounds like. The bones, muscles, tendons, ligaments that connect those things that are responsible for moving the horse around and the horse's whole movement and way of going. It may also be, as you can see in this poor little picture here. Sorry, I'm just going to move the screenshots of people so I can see my own pictures. There we go. This poor little horse here clearly has some issues on the right side of the screen, which is her left front. You can see that that leg is not normal. That is actually as straight as that leg could get. If you look even more closely and look at her little hooves, you may notice the toes are curling up and there's some deep divots there. And this horse actually had some pretty significant laminitis that was causing her to be so uncomfortable that she wasn't using that left front leg very well anymore, which is why it ended up sort of bending and deforming out of place. So anyway, she clearly was lame, and we could sort of tell looking at her that there were some big problems there without even watching her walk. And then she walked, and then you said, okay, that's enough, honey, let me help you. So the whole point of that thing is that what we're really looking for is a pain response, because essentially when something hurts, the horse is not going to move the same way as they should normally. And sometimes it's really subtle, and sometimes it's really, really obvious. I will also say that other things can cause problems with the musculoskeletal system, or with the horse, how the horse is moving. Sometimes it's just weakness that's causing a problem. Sometimes it's a neurologic issue that the coordination isn't there. And sometimes there's mechanical issues, which are often like a conformational problem. And sometimes those are an issue and will cause pain. And sometimes those things are fine, and it's not just pain in the musculoskeletal system that's causing the problem with the horse. So getting into the meat of the matter a little bit more, this whole signs of lameness really varies a lot. We can all have really obvious things, like the horse will not put its leg on the ground. So if you've been oh so lucky enough to have a horse with a really bad foot abscess, you've seen this, and it's terrifying because they won't put their leg down. They are walking really slowly. They're hopping around. They may or may not want you to touch it, but it's really dramatic. It's really obvious that there's a problem. It can also be not so obvious, and just it can be difficult to keep a good rhythm. It can be that the stride length isn't as even kind of front to back, or the overall stride length. They're taking a lot of little steps to get the same distance. It might just be they just don't want to go forward as much. A lot of horses that both front feet are painful. This will be more an issue in jumpers if they've had a lot of impact recently. their feet might get sore, whether it's their coffin joints or their actual bones or the hoof capsule itself. If both feet hurt, their answer to that is just not wanting to go forwards. And there are other things that can cause that too, but just for an example, that might be something that you notice. Or they're not collecting as well. They're hopping into their upward transitions or kicking out with a hind leg, anything that's really kind of out of the ordinary. And the other thing that can also come up is this whole idea of abnormal behavior. Maybe it's when they're being tacked up. Maybe it's when you walk towards them with the saddle. Maybe it's during the ride. I had a horse that stopped standing still at the mounting block. He would just sort of sidle away off to the side so that his owner couldn't actually get her foot in the stirrup. And he just got really, really difficult about it. And it turned out that he had problems in both front limbs that were making him sore. And that was really the only indication that he gave was, I think this might hurt. I don't really want to stand for the ride to be started. But he was a good boy. He knew his job. He did actually like working, so that he would try and work through it anyway. So they can do lots of different things. And it's just a matter of paying attention to what your horse is doing and really noticing those changes. I personally end up leaning a lot on you guys as clients, as riders, as trainers, especially, to kind of know, like, yeah, we've kind of worked through this. We've done the positive reinforcement. We've done the training things, and it's still not getting better. If I come to an appointment and those things haven't been done, we usually spend some time trying to do that. Like, can we use some positive reinforcement here? Give them a treat to stand at the mounting block, for example, really simply. To be like, okay, like, can we get this horse to do that? Or does this horse really not want to do this because there's a pain component? So sometimes we'll end up sort of working through that at an appointment too. Or sometimes I'll say, hey, work on this for a week. And if it's not better, then we need to dig deeper. It all kind of depends on what's going on and what happens in the appointment, as well as what you guys have noticed and observed and tried already before you've even picked up the phone to make a call to your vet. So coming back to this whole idea, I realize this is a little bit busy slide, but we'll get into it. This whole idea that lameness is a response to pain. And again, sometimes it's really subtle what these horses are doing, or the changes in their movement. They're changing how they're landing on their foot by a couple of millimeters. Our eyes aren't going to see that. Our eyes, however, can pick up on all of these other signs of pain that horses will exhibit. So this particular diagram here, this list of problems, is taken from a study done by an extraordinary clinical researcher located over in England, Dr. Sue Dyson. And she's essentially spent her entire career looking at lame horses day in and day out. And she noticed that you can see a lot of weird behaviors or abnormal behaviors in horses that are lame. And being the queen of research that she is, she started collecting data and collected data and collected data, and then analyzed that data, and essentially came up with this list of these 24 different signs or symptoms, if you will, of things that lame horses will do. And essentially found that if they're doing at least 8 of these, it's likely that the cause of that is musculoskeletal pain. So she did a bunch of different studies with this type of thing. And the first one was having people look at video recordings of horses. So they could slow them down, they could pause them, they could watch them a whole bunch of times. And it wasn't necessarily trained veterinarians. It was people that were given the explanation of these are the behaviors to look for, here are the videos. And then they also took these horses and they numbed the areas where the pain was coming from, which is called blocking, which we'll come to as we get to the lameness exam. But essentially they had videos of these horses when they were uncomfortable. Then they were able to numb out the source of pain from somewhere in the leg and have the horse go again. And these are mostly ridden horses, and looked at the difference in these scores and essentially found that applying all of those signs and looking for those behavior changes, so that it changed, that essentially when you take away, that horse's foot pain, it stops swishing its tail, it stops pinning its ears, it stops kicking out or whatever it is, or giving you the intense stare for 5 seconds. But it literally changes. And sometimes we'll pick up on that Or you guys will even pick up that your horse is exhibiting these behaviors, not that you've sat down with this ethogram and, been like, yes, here's exactly the 8, but just sort of the sense of my horse isn't happy doing this is a lot of times what I'll hear. And fortunately, we go through the whole thing, we find the problem, we treat it. And at the recheck exam, it's your horse seems much happier to be working, more content. And really it's that they're not exhibiting these weird behaviors again. They're not holding their ears funny. There's not that tension there. So this Dr. Dyson here went the next step after just being like, okay, well, can we look at this in video recordings, and went to can veterinarians look at this real time when they're watching horses go and be able to use this to help distinguish between lame and non-lame horses? And the answer is yes. And so it's, again, not necessarily something that all of us are using all of the time, but it's more evidence that these things that your horses do are oftentimes not just behavior, and they're actually uncomfortable. And they might be doing this when it hurts just a little bit, or it's just a little uncomfortable. And quite frankly, that is when we would much rather see these horses. It's sometimes a little harder to figure out because it's not so obvious what the problem is, but little problems only need little solutions a lot of the time. And they do a lot better because we only have little problems. We haven't had big, intense issues that have been going on for a long time that we're only dealing with years down the road. Essentially, you can kind of think about it, the time to your horse being better is going to be somewhat similar to the time it was that your horse was developing this problem. That's not entirely true, right? Like we can have pasture accidents that lead to a broken leg, and those happen very quickly, right? And have very long-term healing prognoses, if at all. But, when we're talking about a lot of the wear and tear, which is particularly relevant to the dressage world, and sort of the chronic accumulation of low-level stress over a long period of time on joints or soft tissues, tendons, or ligaments, the longer you let those things go, a lot of times the longer the layup and recovery is going to be and the more intense it's going to have to be. So anyways, that's my little plug to pay attention to your horses. There's science behind these behavior changes actually being significant. And this is something that you guys can do. You can find these papers and find that information out there and look at these things and know like, okay, am I really seeing all of these things? Is this a problem? So just a little something to tuck away and that you guys can do with, not a whole bunch of advanced training and years of watching horses. You can know your horse and know what's normal and pay attention when things are not normal. So moving on, we've identified that there's a problem. You're like, yep, my horse isn't right. Maybe they feel unbalanced. You're noticing things as a rider. You're like, this just isn't as good as it was. My horse needs to be looked at. So what's going to happen at your exam? Lots of things, potentially, or maybe fewer, depending again on how obvious things are. I wish some days that horses could talk and just tell me, yes, it hurts here. Other days, it's probably okay that they can't talk to me, but there you have it. So we're always going to start by looking at the horse when the horse isn't moving. And whether you realize this or not, your vet is probably starting to do that when they're still talking to you and asking you about the history, what's been going on, what have you been feeling. The horse might even be in the stall and they're just watching its normal behavior. It might be in cross ties and they're looking already at how is that horse standing? What is its posture? Is it shifting its weight? Is it grimacing or tightening its nose or eyes? Is it paying attention? Does it seem to have a normal mentation? Does it seem dull? We're looking at all of these things as we're talking to you and asking questions. So we've already started the exam portion of your horse just being there. Sorry, just have some water here. So moving on from that, we'll feel the horses, and we're really looking for anything that's different from normal. So the really obvious things there are going to be heat, swelling, if there's a whole bunch of fluid in a joint somewhere. We're checking what a joint's normal range of motion is, or, if I have a horse with really bad carpal or knee arthritis, they might not be able to bend their knee very much or at all. Or I might have really early signs and there's just stiffening of the joint capsule, but they can't quite bring the back of their fetlock up to the back of their forearm, which is normal range of motion, is that sorry, I'm like making little gestures over here, you guys can't see, but they should be able to bend and essentially get their fetlock all the way up to their forearm. That's normal range of motion in that knee. So feeling for things like that. We're obviously looking for pain, right? Is this horse reactive? Is it flinching anywhere? As we're feeling all the tendons on the back of the cannon bone, are there any sore spots in there? How sore are they? Is it, you know, did I just startle the horse because I wasn't paying attention and I pinched too fast? Or, you know, really consistently every time I feel in that one area, does the horse sort of pull away? Or I'll often have my shoulder in contact with the horse's chest as I'm feeling things, because sometimes their pain reaction isn't necessarily to pull the whole leg away, because they're very kind and gentle souls and they're well trained and they know that they should keep their foot there. So I'll just feel them like tense their chest muscles into my shoulder sometimes. So it's all of those, again, little things. And there's a lot of horse to horse variability too. I mean, I don't know if you guys have ever been around like a 2-year-old thoroughbred colt that's colicking. Literally, he has a little bit of gas and will like throw himself to the ground because he is sure that his world is ending. And then you meet, you know, a 20-year-old broodmare and she's got some terrible problem and she'll just stand there looking at you like, what? I've been through worse. This is no big deal. You know, so there's a huge variation on their pain tolerance as well, and how much they're going to react to things and how expressive and communicative they're going to be about it too. So again, that's where you guys will really come in, because sometimes I'm trying to figure out, you know, well, is your horse always this quiet? And sometimes the answer is yeah, like my horse does not care about much, like totally chill. And other times, no, my horse usually is really interactive and he just seems not himself and he's just not as interested in interacting with people as normal. So all of those things, and there's all that variation as well. One sec. I put confirmation on there because it's something to pay attention to. Really awful confirmation can cause problems and be an issue. It can also be fine, and horses can deal with a lot for a long time. That's probably a little bit more pertinent to say a pre-purchase exam. But even when I'm, you know, if I'm meeting a horse for the first time for a lameness exam, if they're really toed out, you know, where their legs angle in towards the knee or towards the fetlock and then flare back out again, a so-called fetlock valgus deviation per se, I'm going to expect that that horse, again, I'm making gestures, you guys can't see it. But anyhow, this turned out horse here, he's not going to track normally forwards with his leg like this. If he's turned out here, he might paddle, right? And I'm going to expect that to be somewhat normal for that horse based on the confirmation. You know, if things get pathologic where it's a problem, it might be a little different. There might be swelling in that fetlock or through that pastern area from that load being borne unevenly. So we're looking for all of these things and kind of taking into account what we see and then what we expect to see as we're actually watching the horse move. So, oh man.
Hey, Dr. Peters.
Hey, yeah.
You can't see yourself, but we can see you. So please continue with the demonstrations because they're very handy. You're doing them great. Keep doing it.
I talk with my hands, so that's wonderful.
You do. You're doing a great job. I totally get it.
I actually think that I have an old version of my PowerPoint and I have a new one that has more pictures. So bear with me, guys. I'm just going to see if I actually saved my new one because there's really better pictures for this part that's coming up, which is the best part, which is watching them move.
You know what? That's good because while you do that, I'll do the disclaimer thing we talked about. Remember?
Oh, yes.
Yeah. So it's okay. You look for your thing. So I had a bunch of legalese, but I can't find it now. So I'm just going to make it up. It's something about we're providing, the IDCTA is providing this this information tonight as a courtesy and a service. And if you have an issue with your own personal horse, you should speak with your own veterinarian to get to the bottom of it. And you know, that kind of language. So we just had to get that in there.
I'm so sad right now. I was so excited about this. Oh.
Is it a video or just a picture?
No, it was all these pictures with like extra lines so you guys could see all the differences that I'm looking at. And I don't understand why it didn't save. I literally changed it this morning because I had a cancellation. And I was like, oh, good. We can add all the best pictures for this.
Ugh.
All right. Well, we'll just have to do the not amazing pictures, but still decent ones. Okay. Back to our regularly scheduled programming here. And yes, I do appreciate Dr. Gray bringing that point up, because that is one of the really important things is like, we are limited by what we can do through pictures and even videos. And like the best thing is to talk to your own vet. And this particular lecture is not meant to give you diagnoses or know exactly what the different issues with your horses are. Like, your veterinarian is the best person to talk to, but hopefully this talk does give you some tools on ways to expand that conversation. But really, I mean, everything I just talked about is laying eyes and hands on the horse, and your veterinarian is going to be the best person available to you to do that. And then it's a matter of the conversation about what do all those findings mean, right? So the more you can talk to your veterinarian, understand what they're finding, the better off your horse is going to be. So yes, please always talk to your veterinarian about that. So going on to the lameness exam, or continuing the lameness exam and going on to the dynamic portion of it. So this is how I spend a lot of my life. If you guys can look over in that picture towards the left, there's me standing with my arms folded, watching. This is what I do. I watch all the things. And so as this particular horse is trotting right now, but we're going to watch everything that happens. So we're going to watch the horse walking. We're going to watch the horse when appropriate. You know, I'm not expecting that a yearling can necessarily walk, trot, canter on a lunge line, right? So that might be a little bit different. A 2-year-old colt in race training, I'm not going to just be like, oh, can you lunge him for me? It's not going to be helpful. It might be entertaining, but it's not going to be helpful to the lameness exam. And again, depending on what's going on, sometimes, and you know, with those more obvious lamenesses, the horse takes 2 steps, you know, and I see this big giant head bob. I probably don't need the horse to canter to be able to figure out what's going on. And also I usually kind of feel badly for the horse, and I'm like, okay, we'll just do a little bit and go back and focus on that lame leg. But again, where things are a little bit more subtle, I might spend a long time watching the horse. I might ask for several transitions back and forth, because there's a lot to look at, right? We've got all these 4 legs going every which way. We've got the back, we've got the pelvis, we've got the neck, we've got the head. We've got how far apart are all of these legs from one another? What is the rhythm of how they're moving? How heavy are they landing from one diagonal or with each leg at the walk? Sometimes I literally will close my eyes and just listen to the footfalls to hear what's going on. And are they, you know, really coming down hard on that left front every time? Or is that rhythm off? You know, a nice, especially most of you, I believe, are riders. So especially as a rider, you guys all have really good senses of rhythm, and you know what a normal walk should be like. It's that 1, 2, 3, 4, 1, 2, 3, 4, right? And your trainers have you sometimes try and figure out which leg is hitting the ground at what time. And if they don't do that, you should challenge yourself to do it, because it really makes you tuned into what motions are you feeling with your leg and seat, and what leg on your horse does that movement coordinate to. And it helps you develop a really good feel for when are they using different parts of their back again. So when that changes, you can clue in to, oh, I know that when I'm feeling this movement, it's with their inside hind is coming forwards in the air. And so then you can be like, oh, well, that's changed. And like, I can consistently feel that. Pardon me. Or, you know, your horse is amazing. And you're like, this is the best walk ever. And it's always the same solid 4-beat thing that it's there. But sometimes a subtle change in rhythm, right? Instead of that 1, 2, 3, 4 is like 1, 2, 3, 4, 1, 2, 3, 4. And, you know, and I'm exaggerating a little bit, but sometimes it's changing just ever so slightly, just like that. At the trot, obviously, your rhythm is much more obvious because you just have the 2 beats. And that's a lot of the reason trotting is going to be our standard gait for identifying lamenesses. And the reason that is because it's so easy to see asymmetry in the trot. You can really see, is one diagonal the same as the other? Are they the same left to right? And that's a big thing that we're looking for is, the questions I sort of ask myself, especially if things are really, again, subtle with the horse is this normal or abnormal? Is this symmetric or asymmetric? I'm sorry, I'm really needing more water. And with the asymmetry, the trot, again, is kind of the easiest way to look at that. And there's all sorts of ways to look at that asymmetry. So you can look at the horse, from its left side to its right side. You can look front to back. And I'll come back to that a little bit more with some things to look at. You can look at a little bit like even top half of the leg to the bottom half of the leg, because as that leg reaches forwards, it should make a nice straight line, right? And if it's always staying like this and just going along, that's not normal, especially if the other leg is staying straight. So you want to, again, be kind of taking in that whole impression, and then also taking your time to look at all of those different pieces of the horse, and are they all each moving as they should be? So we're looking at all of these things. Of course, if we're at a place and the horse is at a level of training and it's appropriate to the discipline for it to also be doing transitions, those can be really helpful, because you'll pick up on, again, a lot of times asymmetries, and sometimes it's just weakness. And horses are sided, right? And that's normal, just like we're sided, and they're going to be better one way than another. But especially for horses that are just coming back into work after an injury and they're a little bit weak behind, like you can see that they do not push off with that outside hind leg into that canter transition. And it'll represent itself a couple of different ways, but a lot of times, especially the first couple of steps, those hind legs will be closer together, and then they'll settle into a 3B canter, and they can get there and hold themselves. But really that upwards transition is not fluid, and they're really not able to just sit and push with that outside leg. You can watch that get better as they get stronger. And again, depending on what the issue is and what the horse's rehab protocol has been, you might see that like, okay, yeah, it was the right hind that was injured, and that leg is really weak, and the left lead canter suffers as a result. But going the other way, they're just fine because that left hind stayed strong, because the horse never stopped really engaging those muscles the same way. So you can look for things like that. So we're looking again for all of those things on the lunge line. We'll also watch the horse trot in hand. And as I'm sure anybody that's ever watched a vet watch a horse trot, probably 99.99% of the time, we stand directly in line with the horse. Because again, that is the best way for our brains and our eyes to look for changes in between left and right, front and back. Every vet's kind of going to have their own way of looking at the horse and sort of checking off all those boxes of the things that they're looking at. I oftentimes am looking at the back half of the horse as the horse is trotting away, because I can see it better, and I'm looking at the front part of the horse as the horse is coming back towards me. So as the horse is going away, big things I'm looking at are kind of like the top of the butt, or like a little bit, you can kind of draw a line from essentially along the pelvis of the horse, which can be from that top pointy part, that's sort of the highest part of the croup, down to the side to what a lot of people call the hip, which is also the tuber coccyx, or that really hard bony firmness on the side of the horse. So like stand behind the horse, you mentally draw that line and you think about it. And a normal trot, there should be symmetric movement up and down, right? Because both sides should be working evenly, and they're landing and pushing off with both sides. However, say this side hurts and the horse doesn't want to land on it as much. Instead of this nice even thing, you're going to notice that there's more motion with that side, because as the horse is landing, it'll be rotating its pelvis to try and avoid what that feels like, or having that impact there. And as it pushes off, instead of really using its leg muscles and making a lot of contact with the ground and that foot really pushing, the horse is going to lift their pelvis and try and sort of like swing that leg forward. So you get this sort of artificial and excessive pelvic rotation on the side that is painful. there's more, a little bit more to it than that, but that's a lot of what our eyes are seeing, is that increased pelvic rotation as the horse is offloading. And I challenge you guys, if you put a rock in your shoe, or better yet, have your friend put a rock in their shoe and then watch them walk and watch their hips, and the hip with the side with the rock in the shoe will go up and down more because they're not wanting to land all that weight in their shoe, right? So you can see it in people too. And it's the same thing in the horse. There's just more going on. So you just have to focus your eye down. The other thing that I'm gonna watch is where those hind legs are going, right? And in a horse with perfect conformation, that's also capable of trotting in a straight line, which is more challenging. Although again, you guys are my lovely dressage folks, you understand the challenge of straightness. But even in hand, that trotting in a straight line can be challenging. So in a perfect world, those hind legs are tracking directly behind the front legs, right? And they're turned out a little bit, and there's a little bit sometimes of outward swing, mostly so those legs can avoid the abdomen, right? Because it's literally in the way. But you'll notice all horses, they have their hind feet are turned out just a little bit, and it's so that normal path lets the stifle clear the back part of their belly, that flank. But anyhow, so they should be going behind the front legs. But sometimes you'll notice, one leg goes straight behind that front leg, and especially when you're watching from behind, you can see, and when you're lined up, you can see it really nicely. One leg goes straight and the other leg comes in, and maybe it comes back out and lands behind the front leg, or maybe it comes in and lands on midline, or maybe both come in and they're doing one of these, and I mean, really exaggerated, right? A lot of really young horses, again, young thoroughbreds who have these really long pencil legs and like not much muscles to support them, they sort of prance about like this. And as they get more training on them and more strength and all of those things, and, get into the dressage world to make them better eventing horses, they get more motion and flexibility through the hocks. They're able to reach more and they stay straighter instead of this little tiny tightrope thing, right? Or sometimes I see that in an older horse, because usually it's hocks, but not always. It can be really anything, hurts in both legs. And so they end up tightroping because they're actually tilting their whole pelvis with every step, trying to like minimize how much impact there is on each leg. So that's the hind end, which I know is like, for most people that I talk to, hind end lameness is a little bit more difficult for their eyes to pick up on. And a
Dr.
lot.
Peters, we have a really good question, and it's right. It has to deal with this, otherwise I wouldn't interrupt you. But and there's only 20 minutes left. But
okay,
the question is, when might you decide that the lameness exam needs to be a ridden exam?
That is an excellent question.
I know it is, and it's not from me. Somebody actually typed that in. So
my unsatisfying answer is it depends. But better yet, it's when things are not obvious in hand. Just trotting the horse, I'm kind of like, I'm not sure, that I definitely want the horse to be ridden. Or if really the presenting complaint, so what you guys are calling me about is when we do this under saddle, my horse struggles. Well, then I need to see that, because I need to see what's happening. So again, it depends a little bit, but for sure, if it's not really obvious on the straight line what's going on, and there are definitely problems that get much more pronounced under saddle. There's other ones that get better under saddle, because accidentally as a rider, you're helping balance the horse. And when we take away that crutch, you can see a little bit more of the lameness because they can't lean on you to balance themselves. But I would say that's sort of my weaselly answer is it depends. And if it's not obvious what's going on in hand, or if what I'm seeing on the ground doesn't fit with what you've told me. If you tell me that the horse is falling out behind, it kind of feels like there's a flat tire and that they're, kind of behind you, and that's only an issue at the canter, and I see only a very mild forelimb lameness, that doesn't fit, right? That doesn't make sense. So I say, okay, like I need you to get on because what you're describing is not what I'm seeing, and that doesn't make sense. So we need to find the missing piece of the puzzle. So that will be part of it. If I also can't, a lot of back and hind end issues will go hand in hand, and you're left wondering what's the chicken, what's the egg. Was the back sore, and then the horse went hollow and stressed its legs, and now the legs are sore, or was it sore in its legs? So then it was carrying its legs awkwardly, so then it got back sore. Sometimes I'll use my ridden exam and changing how how the rider is sitting. Are they in 2-point? Are they sitting down? Is it a sitting trot, posting to the wrong diagonal? All of those manipulations, if you will, to see how the horse responds and get more information that way. So hopefully that answers your question. Silently with the chat box. Yes. If it doesn't, respond back and Dr. Gray will interrupt me again. Super. Yes, and I will get a little bit of a move on. So that was the hind end. The front end, in terms of watching for lameness, is sort of that classic head bob. So if you think about, again, as lameness is a reaction to pain, if a horse puts its leg down and that leg hurts, they're going to try and shift that weight off of it, right? And when they have that big head and neck, they can really change where their center of gravity is. So sometimes it's to the side, sometimes it's up and down. It's those things. So that one's a little bit easier to see. If it is subtle, I will challenge you to look at your horse's ears in relation to a straight line next to the horse or behind the horse. So like in this arena, in this picture here, and like a lot of arenas I go to, there's these beautiful straight lines built right into the wall. Okay. And so if I'm watching the horse trot from behind, I will watch those little ears in relation to a board that's behind it on that far side of the wall. Or I will watch from the side. I'll literally go to the middle of the arena and look from the side and watch the ears as they're moving alongside. And are those ears changing in relation to the height of that board? So use those visual cues. Our brains are really good at looking for patterns. It's much harder when there's not sort of a frame of reference to see those changes. So use your environment, use what you've got around you. If you're riding outside, there might be a building in the background and you can use, the intersection of the wall of that building and the roof as your straight line to help your eye look and see, is there a deviation from normal here? Is it changing? And the normal trot should go up and down and their head should kind of be swinging back and forth as they go. But if it's swinging more one way, and maybe it's little, right? It might be little, but then you look closer and you see that they're tensing everything. A lot of times that's like, we will joke a lot about how many times we get called that it's in the shoulder. My horse has got a problem with its shoulder. Shoulder problems themselves are unusual, but what is common is that you are recognizing that your horse is clenching all of those muscles and lifting up to keep that leg from taking all of the impact. So you may see the changes in the shoulder. It doesn't necessarily mean the shoulder's the problem, but you'll see that, and that is an indication that there's a problem in that leg or somewhere else that's then referring into that leg. So I'm going to get along to the imaging here because I think that's a little bit more interesting. If anybody wants to talk more about flexing horses and the benefits and drawbacks of that, I am happy to chat about that later.
15 minutes.
How much?
15 minutes left.
Yeah. Okay. We're going to move on. Other thing I'm just going to throw out there is there are also some tools out there. I use this one for some objective lameness measurements. So we actually have some sensors that go on the horses. So you can see he's got a little bonnet there. There's a little black thing on his pastern, and then there's a little sensor on the pelvis as well. And it helps actually measure those up and down changes from side to side. So especially when things are subtle or there's a lot going on, it's just one more tool in the toolbox to help actually, again, quantify what our eyes are seeing. It's not the end all and be all, it's just one more thing. It is personally really useful for rehabilitation cases where we're coming back and we want to make sure and be able to measure how much improvement has this horse made. It's very satisfying to be able to put numbers on that and be like, yes, we are actually 70% better. So that is also out there in the world as well and can be a really useful tool. So we figured out which leg it is, or maybe pair of legs from watching, but our flexions didn't really tell us much. Maybe there's some fluid in some of the joints, or maybe there's not, and there's not really any heat, and it's not really obvious where the pain is coming from, just from watching and using our hands. So their next tool that we have available to us is often called blocking. So this is where we use a substance, just like you go to the dentist and they use Novocaine to numb your nerves. Same exact class of drug, and we put it around different nerves to figure out where that pain is coming from. So the nerves all run from the top of the leg, essentially closer to the spinal cord, out to the periphery. And so we can start at the bottom and work our way up. So we can numb, those nerves that are right, those medial and lateral palmar digital nerves, or PD nerves, which essentially right above the heel bulbs, we can numb those nerves, and we're numbing for sure the back third of the foot, sometimes the entire foot, kind of depending on your technique and where exactly you do it. So if that horse's pain is actually coming from the foot, then when you numb those nerves, the horse will go sound on that leg. And maybe there'll be sound overall, maybe a lameness in a different leg will show up, because now you've made that first leg feel better enough that they can be like, oh yes, this other one hurts, let me offload that one and not land on it so hard. And if it doesn't block to its foot, we can move up and then go, essentially sequentially to rule in or out different parts of the leg and where exactly this issue is. As much as we would all love it to be like, oh yes, like this horse is doing these things, it must be this body part or this joint, like clearly this is a stifle problem. Most of the time we'll be right if we're pretty experienced, but not always, because horses all present differently, and all that we can really tell is that leg hurts. Okay, so if your horse doesn't respond to the first treatment that's done, or like I've totally done this where I'm like, oh yeah, like, it looks like a stifle. We take x-rays and there's nothing in the stifle. It's all normal. And I'm like, that's weird. So then I block the stifle and I numb just the joint, and it doesn't fix the horse. And I'm like, oh, the stifle is not the problem. Like, even though I thought it was, it's not, right? So we need to find where the problem is so we can figure out what the problem is, so we can have the almighty diagnosis and know what it is we're treating, so we can figure out the best treatment for that horse, for that owner, etc. So being able to know where the problem is a really, really, really important part of the lameness exam. And that's like why we do all of this watching and observing, is to figure out where this issue is. And even with that, we still need to go to blocking a lot of the time. So that is what blocking is. So now we know where it is, right? So say this horse did in fact block to that medial and lateral palmar digital nerves, or a PD. Oftentimes we'll say you block to a PD or you block to his foot, right? Almost always our next steps are like, okay, it's his foot. There's a lot of things in the foot. There's a lot of things in every body part. So then the question is, what is the problem? So our first step is often going to be radiographs or x-rays. My guess is most of you guys are pretty familiar with this. We've all seen x-rays on TV a lot of the time. Maybe you've had them taken of yourself, or you've seen vets hanging out, taking x-rays at your barn, maybe on your horse, who knows? But it's all relatively portable these days and digital, which I'm very fortunate and thankful for. But it'll look something like this, right? There's a plate, there's a generator, and there's a little computer if you look kind of behind my back in that picture there. And as we take the x-ray, the image will come up so we can look at it. And x-rays are really good at looking at bones and joints. They're not great for much else, but they're really good for that. So this is, an example of an image that you'll see. This one doesn't have any big problems on it, but our big thing that we worry about, that we screen for with x-rays, is looking for arthritis, right? And obviously fractures and other problems with the joints themselves. But there's more than just bones and joints in that leg. So we also have things like ultrasound available to us. Ultrasound sends sound waves through the skin. If you haven't seen one, it's a little machine, usually about like this big. Again, it has a screen, and there's a little probe that we can put directly on the horse that sends the sound waves through the skin, and based on what that tissue is, bounces back and gives us a picture like this. This is actually my horse, my dearly beloved horse, who decided to have a whole bunch of swelling around his suspensory branch. And if we look, oh, I don't know if I can do this. Aha. You guys look right here. That is his part of the suspensory ligament. So it's got these nice fibers coming down here to attach to this bone. Sound waves don't go through bone, so it's just this white line with black underneath it. Then you get all this swelling. This is a big vein right here full of fluid. But his suspensory ligament was in fact intact, much to my relief. And he had just knocked himself and had a whole bunch of swelling here. And he was my horse, so I freaked out. I was sure there was a big problem, but it was all fine. So this is an example of what a musculoskeletal ultrasound image might look like. However, sometimes that's not enough. Either the problem is smaller than what the ultrasound can see, or again, these pesky, pesky feet, there's a hoof capsule in the way, and sound waves cannot penetrate the hoof capsule. So then we're looking at some other options. Or we're looking deep into the leg, and ultrasound can only go about 20 centimeters in, so like that far. And if you think about how big like a horse's pelvis is, we're not going to be able to see all the way into the middle of that. So we have some other options available. And these next three are not portable. They cannot be done on the farm. And this is when we may end up needing to refer or sending you to a hospital to do something. Oh no, how do we get back to this? There we go, mouse. Bear with me, guys, you're doing great. Maybe, there we go. So clear all drawings. Thank you, you guys are very patient. So that you might need something like an MRI. So again, I have an exclamation point next to feet. MRI is wonderful for the feet because it can really do a great job of imaging all of those little tendons and ligaments. There's a whole bunch that are inside your horse's hoof capsule, and depending on which of them are damaged and what the degree of damage is and how many of them and the relationship of it and how the navicular bone is, all these things is going to depend on what the best treatment for your horse is. So a couple of things about an MRI, there's two different versions. There's one that is done all the way under anesthesia, which is what this picture is of. This is of the unit at Rood and Riddle down in Lexington with one of their anesthesia techs who's monitoring this horse. That's electrodes that are measuring the EKG just to keep an eye on the heart rate as the horse is under anesthesia. And then you can see that round, it's called a gantry opening that leg can go in. Obviously, you can see the entire horse cannot fit through that little opening, right? So there's a limit to what we can image with the MRI that's going to be dictated by size. A really big warm blood will be able to get up the leg to the level of the suspensory organ. We're not going to be able to get a stifle in there. If we have a very small yearling, we might be able to get a stifle in there, but it's going to be difficult. So just the anatomy of the horse and the size and what's like literally physically available is going to limit what we can do. It's always a good chuckle. Every now and then equine hospitals will get a call from the human hospitals that say, we have a really, really obese patient. Can we come use your MRI? And then we laugh and we say, well, we actually have the same units that you guys do. We only can just put part of the horse in there. So sorry, can't help you. So that's literally just the technology that is available. So that's the one that's under anesthesia. It has better resolution. We can look at much smaller slices. There's also a standing option, which you cannot see as much of the leg. This is the kind of image that you will get from an MRI as well. There's a standing image. Wisconsin Equine has one. So practicing in Wisconsin and Northern Illinois, that's probably the closest place. Obviously, you don't need general anesthesia, and you still get some good images, but occasionally you have lesions that the standing unit will miss because it just doesn't get small enough slices. Other things that are out there will be things like a bone scan. This is what it looks like. There's essentially, you give the horse a shot of a radioactive compound that goes into areas of bone damage and stays there, and then that machine that's over the horse's pelvis right there is actually a big gamma camera, and it makes little pictures of the radiation that's being put out from the bone that you see in the image below. So that's the example of the images you will get. It's really helpful for like fractures in the neck, spine, pelvis. It's helpful to know if kissing spine lesions are actually a problem or if it's just a finding on the x-ray as well as your clinical exam. So sometimes if you hear people talking about bone scan, that's what we're talking about. Places near us that have one are going to be the University of Wisconsin and Chicago Equine, to my knowledge. The next thing, which is a little bit new on the scene, is going to be a CT. So there's two different versions of a CT shown here. In the bottom picture is going to be the one that's at the University of Wisconsin. That's their unit. And that little hole actually rises up from the floor. And so it can image the legs and the horses here. Again, they're standing, which is nice. At my dear sweet alma mater of Penn Vet, which is the top picture, they actually have a robotic CT, which was originally developed to image infants actually that were in the NICU and that were in like oxygen cages, and they couldn't, like, they're too sick to be taken out. And so they needed imaging that could like image through all that glass and move around them without moving these really delicate infants. And somehow they figured out that that would also be super helpful for horses. So that particular one can get all sorts of body parts, but it's in Pennsylvania, which doesn't do us much good. CT is really, really good at looking at bone and three-dimensional things. So it's pesky fragments, problems in the center of the bone. Or there are occasionally fractures that don't show up on X-ray because they haven't displaced it all, so you can't see the gap. So CT is really, really good for those things. So that end got a little bit rushed, and you will see that I am not even going into treatment. Obviously, we're out of time, but treatment, literally, my little cartoon there is to infinity and beyond. The way that you're going to get the best treatment and figure out the best option for your horse is to have an accurate diagnosis. Because if you know what the problem is, then we know what the best treatments are. Like, that part is much less complicated, but getting to that diagnosis part can be a little bit tricky. So in that mad dash towards the end, thank you guys so much for hanging with me. I really appreciate it. And that is my troublesome, pesky little thoroughbred there on the left.
Yes.
Tail that I haven't washed yet this winter. So, questions?
Molly, you got some questions before the talk, didn't you?
Yes,
or
and
no?
I sent them to
Okay.
Dr. Peters. So
Okay.
I think she covered most of, at least the ones that I heard, that I saw pretty much in her talk. So thank you.
Okay. I'm going to just mention that our next episode of the veterinary Zoom series will be on May 19th. We're keeping these on Wednesdays, and that's going to be Dr. Heinze and Dr. Weathered from Fox Valley Equine Practice talking about gastric ulcers. So have we started sending out anything about that yet?
We don't usually do it until after this one is over. So it'll go
Okay.
out tomorrow or the next day.
Well, put that on your calendar.
Yeah. Dr. Peters, thank you so much for your time. It was a wonderful talk. I've learned a lot, but I've also learned a lot from you in the barn. So, so a lot of those machines I already knew about.
For better or worse.
Worse, right,
So,
right.
You're very welcome. Thank you, guys.
Thank you. Have a great evening, everyone. And Brittany joined us. Brittany is one of our co-hosts here. She will be, see her on the next Zooms as well. So thanks, everyone. I'm going to stop the recording and we are good to go. By the way, the recording will be on the website probably by tomorrow evening. It takes a little bit of time for it to develop. And then once it does, I've got to load it into YouTube. So we are good to go. Thanks so very much and have a great evening.
Thanks.
Good night.
Good night.
Thank you.